Now in its third year, the Mobile Point of Care Conference 2010 was hosted by Tracline and brought together an NHS audience to share experiences of mobile computing solutions. Most recently held at the BMA, speakers from a range of healthcare settings discussed the patient benefits and efficiency gains.
The need for a solution company like Tracline is quite simply to join up the dots working with the clinicians and the IT people in a hospital. It doesn't work without three parties and three parties working well. We work with both the clinicians and the IT departments in a hospital to make sure that we set the objectives, we set a plan of action and we achieve it in a timely, cost-effective fashion.
Patient safety benefits, I think, with using mobile devices is that you've got information at the point of care, therefore you can have a much quicker response time with investigations and treatments. The other issue is that because you've got information available, there is less duplication and therefore reduced risk in making errors. The other thing I think is because we're using shared assessments, you've got a more holistic view of patient care and therefore hopefully better patient outcomes.
One of the key benefits we measured was productivity, and we recognised that there was approximately 33% increase in productivity by the use of mobile devices. We also managed to reduce our estate's overheads, and the work-life balance of our staff was also improved.
The safety benefits of mobile applications with things like Patient Track, they take technology to the bedside, which reduces the error rate. They allow for the capture and accurate calculation of early warning scores. During our trial we found there was a 20% error rate when you did them manually. It makes the charts legible, which has an obvious safety benefit. It makes the charts accessible to any clinician with access, authorised access to the network, so that doctors at the bedside can get the specialist advice they need without getting everyone to the bedside.
The major patient safety benefits that we had were in a couple of different areas. We reduced the length of stay, which reduces the exposure of patients to hospital-associated infections, for example. We reduced the number of admissions to intensive care and the number of intensive care days that we used across the patient cohort. We also saw reductions in the cardiac arrest rate and the mortality rate, although we didn't actually power the trial to look at those areas, but we did observe them during the study period.
The patient safety benefits are bedside medication verification, so we've implemented this at 200 of our hospitals in the U.S. and it's greatly reduced the medication errors. In fact, we're the only hospital corporation that has implemented this type of system. So each unit dose drug has to be barcoded, the patient wristband has to be barcoded, the computer system makes sure that it's the right medication for the right patient at the right time.
As the population ages, more and more people are in the latter years of their life going into nursing homes, so it's becoming a more important place to think about where care is delivered. Nick Barber did an excellent paper showing at 55 different nursing homes in 3 different areas, looking at 256 patients and looking at what medications they were given. Over 69.5% of them had had at least one error. I think mobile point of care technology could well help to improve and reduce those errors and make it much safer for patients.
Well, the drivers for using voice recognition are primarily a poor typist, and the imperative to have good, clear text clinical notes is, in my opinion, the gold standard of clinical documentation.
Tracline's involvement in our project was fundamental, I believe, because they highlighted to us the possibilities that technology can provide for mobile workers, and they also introduced us to a piece of software called Excelinet, which I feel is fundamental to the project because it allows wireless connectivity to be enhanced when out and about.
Cornwall Health have worked in partnership with Tracline for a number of years. They are the market leader with a proven track record. They have added significant value to our mobile working project, being able to provide advice and support either on-site or virtually whenever required.
Tracline's Mobile Point of Care Conference is an excellent opportunity for people from disparate backgrounds to come together and learn about what is actually happening on the ground, share experience, and then perhaps for people to take back to their own organisations and see if they can implement them themselves.
Well, I think the importance of the Mobile Point of Care Conference for the NHS has been the ability to draw many different professionals together to develop the concept of mobile working and looking at the variety of hardware and software solutions. It's never a one-size-fits-all, and I think the flexibility that clinicians need to be able to have a variety of hardware and software solutions is critically important.
The benefit of the Mobile Point of Care Conference today has really just been to see the experiences of other NHS providers and indeed private providers in implementing these kinds of projects for patient safety reasons. It's interesting to see that the same themes are coming out along the lines of winning over, using champions, and actually the issues are really around the human factors rather than necessarily the technology factors. But it's been a fascinating conference in that regard.